For a case of stridor or noisy breathing, using our mnemonic old cards will note the onset, or when did your child's noisy breathing start. For the duration, we'd like to know if it's been constant since it started, or if it occurs more intermittently, for example at nights only. If it is, we'd like to note the frequency, that is, how long does an episode of the noisy breathing last for, and how many episodes is your child having per day. Next, we'll want to note the progression. Does your child's noisy breathing appear to be occurring more frequently or getting worse? Or if there has been no progression, we'll also want to state that in our patient note to show we've asked. To help characterize the noisy breathing, we'd like to ask the parent, what does it sound like? And to know if there have been any aggravating or alleviating factors. In all pediatric patients, instead of a physical exam, we're going to use our mnemonic BITTER to remind us to ask about the birth history, immunizations, developmental history, diet, education, and to reflect with the parent. For all cases, let's order a physical exam, CBC, and serum electrolytes. In a foreign body, our supporting points will include noisy breathing, a cough, and since it is a bodily fluid, we'll use our mnemonic A, B, and C to write down for our patient note the amount, if there's any blood, and the color. Shortness of breath, and because the baby or child may be too young to communicate this, we'll ask the parent if they've noticed a breathing fast, belly breathing, or any nasal flaring. And we'll have a history of playing with toys. We'll add to our workup a chest x-ray and a bronchoscopy. In a laryngeal papilloma, similar to the adult laryngeal polyp, in adults the polyp was from a heavy voice use. Babies or children are unlikely to be having heavy voice use so young, so the source of their papilloma is HPV from mom. It's also known as recurrent respiratory papillomatosis. We'll see noisy breathing, hoarseness. Also, we can note a cough, and we'll use our mnemonic A, B, and C, and shortness of breath if the papilloma is obstructing the larynx. And since the baby or child may not be able to communicate this, we could ask mom or dad if they've noticed the child or baby breathing fast, belly breathing, or nasal flaring. And we could also note on our birth history a history of vaginal delivery, and for mom, a genital warts. And we'll add a laryngoscopy. In laryngitis, the pathology is a viral URI. We'll see noisy breathing, hoarseness being the key finding, and like any upper respiratory infection, we could note runny nose and a cough. And for our patient note, we'll use our mnemonic A, B, and C. We could also see a sore throat and a history of a fever. And we'll order a respiratory viral panel. In CRU, the source is parainfluenza. We'll see noisy breathing, hoarseness. Since it is a virus, we could also note a runny nose, conjunctivitis, and the key or high yield finding being a cough, a barking cough. And for both, we'll use our mnemonic A, B, and C to characterize the runny nose and cough. And we could also have a fever. And we'll order an x-ray of the neck. In CRU, we'll be expecting to see tracheal narrowing or steeple sign. For epiglottitis, the pathology is Haemophilus influenza or strep. We'll see noisy breathing, and now the 3 Ds. Drooling, dysphagia or difficulty swallowing, and a respiratory distress. So we could ask mom or dad again if they've noticed their baby breathing fast, belly breathing, or nasal flaring. We could also have a cough, and if we do, we'll use our mnemonic A, B, and C, and it will characteristically be alleviated by leaning forward or the tripod position. We could also note a fever, and we'll order an x-ray of the neck and expecting to see in epiglottitis a swollen glottis or the thumbprint sign.